Hi again, everybody. It's Dr. Darya Ghafourpour here. Thanks again for joining me. I had a little bit of a mishap, it seemed, with my first live broadcast here. So if any of you are watching live, then you'll see that things are looking a little bit different here, and we shouldn't have any issue now with sound. So I've switched away from my computer and now I'm going for my cell phone. So whoever is here joining me, would you mind please letting me know if you can hear me okay? And wave hello, give me a thumbs up or a heart. And I'd love to know if I'm coming through okay for you. Yay, Lana hears me. Thank you. Well, I'm glad that you're here, whether you're watching me live or whether you're watching me on the replay. Thanks for the heart, Lana. Yes, I've been having fun with this. One of the things that I've resigned myself to, just by the way, is that I've been testing out various ways of delivering my message to you. And what I did just now is I was going directly from my laptop, and for some odd reason, unanticipated, even though I thought I tested things out, I wasn't able to be heard. So thanks for joining me here. And you know, normally you're seeing me on Friday evenings where I'm giving some inspirational, hey Jamie, thanks for joining. I'm glad that I'm sounding good. Yeah. So normally I'm here on Friday evenings talking to you about positive topics, things, ways of brightening up your life, your day. Today I am going to use the same spirit with a more honed-in message for other dentists and dental team members. And so please pass this post along to other dentists or dental team members that you know of. Invite them to come along to my page here on Facebook. I'll also be reposting this on YouTube. And what I want to do is start building relationships with other dental professionals and develop a following in that respect so that together we can help serve our community in a super positive way. And I want to do that by sharing with you insights that I have, that I've learned and developed over the last 20 years of my dental practice. And a lot of what I'm going to share with you is based off of feedback that I've received from my patients who are impressed, they're happy, they feel comfortable, and they'll say, gosh, I wish my other dentists did something like this, or you should teach other dentists how to do this. And so finally I'm doing that. So it's a little bit different from my teaching at the dental school, which I've also been doing for about 20 years. And I really enjoy that interaction that I have with student dentists. And of course, they're welcome to join us here too. My intention here is to be able to share my insights with dentists who are already practicing. And so perhaps you have found difficulty with having patients come back to receive the treatment that you recommend for them. You may notice that they kind of disappear and you wonder about them, and who knows, for whatever reason that is. But what I found is that when I can keep up with some of these tips that I'm going to share with you today and in future broadcasts, our relationships between myself and the patient, and also between my team members and the patient, become more solid. And as you know, our patients are the lifeline of our business, and without our patients, we don't have a dentistry business. And so it's super important that they feel comfortable and that they want to return to us for continued dental care. So what I hope to do through speaking with you today and communicating with you in the future is to build a community of dentists and dental professionals who can really touch the lives of people out there who may be very afraid to go to the dentist, and they're neglecting their personal health. And they might think that it's limited to, well, gee, I've had this toothache that's been bothering me, but it's not that big of a deal, it's okay, I'll just keep putting it off. They might not realize that they have something pretty significant going on that's affecting their entire body health. And it's for us to educate them about that. But we can't do that if they don't feel comfortable enough to come into our doors and to stay with our practice and return to our office for continuing care. So I hope that I'll be able to help you achieve that end and have fun while you're doing your dentistry, because when our patients are happy, it's so much easier for us to be happy. So what I want to alert you to right now is that I've got a very short checklist that you can download. If you go ahead and text, use your cell phone, text the message, the number 44222, and that's going to send you my way. What you'll do is you'll type in these special letters, DRDARYA, that's Dr. Darya, no dots, DRDARYA, and you'll be able to enter your email address then and receive a downloaded PDF document to your email. So go to text 44222 and enter DRDARYA and look forward for a PDF document, which to you right now is going to look backwards because I'm doing this from my cell phone. But this is a checklist that you can receive from me, which is a summary of what I'm about to share with you right now. Okay, so I'm calling that 3 tips for converting new patients into longtime customers, and we'll start with the first tip. There goes my misbehaving computer. Let's lower that volume right now. Okay. And the first tip is to meet your new patient in your reception room. So you'll know that they're there if you have a small enough office, or if you can hear what's going on out front, you'll get a sense of when we're there. You may have an internal office communication system where your front office team is letting you know that your next patient is there. I usually wait until I know that they're sitting down already with their paperwork. Sometimes I don't have a choice because I'm in the midst of a procedure already, and I'm really just looking for that convenient moment to just stop what I'm doing, give my patient a small break, and then walk up to the front reception area and introduce myself. And I'm telling you, they don't expect it. Unless the person who referred them to you has already told you that that might happen, they're not expecting to see you, and it's a really nice surprise for them. They're taken aback and they're impressed because you care to go out and greet them. For me, this comes naturally because I see my dental office as my own home. The ding was me opting in. All right, Jamie, I'm glad that you did. I'm so glad that you're joining me and joining my community here. So, you know, they're not expecting it. And when someone comes to my home, well, I'm opening up the door, I'm greeting them, I'm welcoming them in. And I'm not opening up the door to my dental office, but I like for them to feel welcomed by me personally. And they can put a personality to the face. They've perhaps already been anxious. They haven't quite known what to expect. It was a big enough deal that they would pick up the phone and make an appointment to come into the office in the first place. Now they're there, and typically people feel a little bit anxious. Sometimes they feel really excited, and they'll let me know that too, and that's awesome. That means that we've done our job all the way around because someone referred them to us and someone gave them the confidence, you know, and told them, you're going to have a great visit. You're going to love her. You're going to love them. Everything's going to be just fine. So I'll typically, you know, extend my hand out. So nice to meet you. Welcome to the office. I'll call them by their name, and it just comes out. I'll say things like, I'm so glad you're here. I'm so glad you're here today. I know you're filling out some paperwork right now. It's going to take you a little while. I just wanted to pop out and say hello and welcome you and let you know that my assistant is going to be in momentarily to, as soon as you're done, to invite you back and go ahead and start with your x-rays, for example. This gives me a chance to sense where they're at, you know, what their personality is like if I don't already know who they are. If they're very tense or nervous, you can see if you can break the ice with them in other ways. If they're sitting down already, maybe I'll sit right next to them for a few moments and just ask them, you know, do they have any particular concerns for today that I can be aware of to help them have an easier visit, or to make sure that I can address their concerns. These are examples of things that I'll say to help them feel a little bit more at ease. Because as we all know, when our patients are at ease, we're more at ease, and it makes our work a lot easier and more fun to go through. So that's my first tip. I will tell you that I was particularly inclined to include this tip in my broadcast with you for today. I'm thinking of one person in particular who's I'll say, self-described fraidy cat. And almost every time he comes to see me, he'll let me know that. And he'll just say, I was terrified when I came. And he's, you know, in his 50s, 60s. He came with his wife, gripping her hand. He was that afraid. And the only reason why he was in my office is because he had a toothache. And a lot of times that's the only reason why people come to our offices. They've allowed for something to get so bad that it finally hurts them. And as dentists and dental professionals, we know that by the time someone is feeling tooth pain, usually the condition has gotten pretty advanced. And that's often what drives people to come in. And so they have some reasons to be afraid in their mind. There's so much that's going on up here that we can do, that we can be aware of. And if we can help put them at ease about whatever is going on in their head, it'll be that much easier to move forward to help them out. This particular person will tell me from time to time, he was just like, oh, I knew. As soon as you came out and you told me, it is so nice to meet you. Don't worry. I'm going to take care of you. He said, I knew I was in the right place. And I thought, I didn't remember saying those exact words, but I knew that I had communicated with him and I could feel how afraid he was. And just the way he reflected that back to me, I thought, oh, wow. If someone came to me and introduced themselves and told me that, I would have melted right there, you know? And that's how he felt. So it made me feel good that it made an impact on him, and that's my intention. And I hope that this will make an impact on you, and you can perhaps shift something that you're doing. And you know, it only took me 1 minute, 2 minutes to go out and say hello to him or anybody else. And I let them know, I'm going to go back to what I'm doing, and I'll look forward to seeing you once you've been invited back. All right. Tip number 2, if your patients are telling you that they have sensitivity, it could be from tooth pain, it could be from gums, offer them a numbing rinse before you begin their exam. So this is once you're already in the operatory, and perhaps they've already taken their x-rays. Maybe they haven't. I will tell you that and I'll give you a little bit more specific about what I mean by the numbing rinse, but there's a psychological effect that happens when people are rinsing with an anesthetic. They start to feel immediately like, okay, things are going to be okay. It's not going to hurt, because people are afraid that things are going to hurt. Even a dental x-ray sensor can be a little bit uncomfortable. If someone has a gag reflex, this is a great trick for helping to subdue that gag reflex a bit, okay? So what I do is I use something called acetylcholine. Now, you can use your standard benzocaine. It doesn't matter too much what you use, but the stronger topical anesthetics are going to be a little bit more effective. The acetylcholine is a combination of the benzocaine, butambin, and tetracaine. And all you have to do is, okay, I'll show you with my fingers. Take about that much. Put it in your little Dixie cup and just give a little bit of water. Just about that much of water, okay? So it's kind of concentrated. Have them rinse it out in their mouth for about a minute. And sometimes I'll just go ahead and I'll watch my clock. And I'll tell them, I've got my eye on the clock, go ahead, keep on rinsing. Because the longer they rinse, the less sensitive they're going to be. And it'll give them peace of mind. And I'll tell them too, this is just a topical numbing gel. You'll be feeling back to normal by the time you leave here. I don't know for sure that they will, but they pretty much, it's just topical anesthetic gel. I'll tell them their lips and their cheeks and their tongue are going to feel weird, but it's really helpful. It'll make the x-rays easier for them, especially if they're gaggers or if they have very small mouths and they're particularly sensitive to the pressure of the x-ray sensor. And when you're doing your gingival exam, when you're doing your probings, it's just going to be a bit easier for them too. So I've also learned from people that this was really helpful for them. They said, wow, you know, I haven't had that offered to me in other dental offices. So right away it's impressing them. And even if they don't really feel sensitive, if they don't have dental sensitivity, if they don't have gingival sensitivity, they feel that you're offering them something to help make them feel more comfortable. And that's the bottom line. When we can help our patients feel more comfortable, they're so much more likely to have a better experience, and they're going to want to come back for the treatment that you recommend they come back for, whether that is another recall exam and dental cleaning, or whether it's for the dentistry that you've proposed restoratively for them. So, and again, I'll have that on the handout that you'll be able to print out. And the last tip that I want to share with you has to do with wrapping up your appointment with them. So again, making reference to how I feel like my patients are visiting my home when they come to my office. That's how tied I am to my office. It's my baby, really. And even when I was working for other dentists once upon a time, I felt that connection and that sense of pride in my work and in my presence there. And I really wanted for the people that I was working with, specifically my patients, to feel like they belonged. And so my recommendation is to walk them up front, hand them off, so to speak, to your front office team again. So if you can do it yourself, that's great. If it flows better for your dental assistant or your dental hygienist to be the one to walk them up front, then so be it. The bottom line is that you do a really great wrap-up with your patient. If you're not going to be the one to walk them up front in the end, and the reason is because it's a really strong way to tie up the appointment. It's a strong way to, you don't want to leave them hanging. If they're rinsing out their mouth and the assistant disappears and you're already with your next patient and they're just kind of standing around going, are we done? That doesn't leave a positive impression on them. You don't want someone to be wondering what to do next. Make it easy for them. Tell them what to do next. Lead them the way. Lead them to the front where they're going to schedule their next appointment. Not everybody's going to be able to schedule their next appointment right away, but make that attempt to help them schedule that next appointment. A few things happen when you do this. If you can be the one up front doing that, then you can confirm with your treatment coordinator. So-and-so is, we just had a great exam and cleaning, or our visit went really well, and I've recommended that we take care of some fillings. I've already entered them into the treatment plan, and the one that I really want to start with is the upper right molar. And so you're talking to your treatment coordinator, you're looking at your patient, you're drawing a connection there so that in your patient's presence, there's an understanding, there's a mutual understanding of the recommended treatment, and they're much more likely to schedule ahead of time since it's cinched right there. They know that the doctor has communicated with the treatment coordinator. If they were so inclined to go, it's okay, I'll schedule later, well, I don't really know what my schedule is, well, all of those well buts, they're going to be much more likely to go, okay, let's just take care of it right now. They're not leaving with a question mark in their mind of what to do next. And so that's a great way of handing off a transition from you in the back office to the front office. If you know that your assistant or hygienist is going to be the one escorting your patient up front, then what you can do before you leave them in the operatory is assure them that you've already entered their treatment into the computer. Your front office staff already understands what's to come next. You're going to go right now and make sure that she understands what to do next. And that's it, Tell them goodbye. Again, let them know how great it was to meet them. Thank them so much for coming in today, taking a part of their day to join you. And let them know that if they have any questions or concerns, they can always call or email. Give them an opportunity to communicate with you, and do your best to communicate back with them. I do my best. Sometimes I'm guilty of not being able to get back to them right away, and my office team is really great with trying to keep me on track with that too by reminding me. And so, I found that these 3 tips that I've shared with you here have been really important in strengthening the bonds that, start from perfect strangers and allows you to build a relationship that can last on and on for many years to come. And those are things that are really highlights in my dental practice, is understanding that I have people who come back, you know, time and time again, and I look forward to seeing them. I love it. Hi, Paul. So glad to see you here. Welcome. You know, that's what makes my life really happy, is looking to see who's on the schedule for today. Being glad that I get to spend some time with them, and feeling honored that they've chosen me as their dentist and my office for their dental provider. And so I hope that you've enjoyed and found value in what I've shared with you today. I want you to be on the lookout for more of these live broadcasts. I'm going to see what day is going to work best. It might be Sundays, Sunday afternoons, the way I've done now. It could be a little bit different, but please follow me on my Facebook page. Go to the notifications tab and select to be notified for all videos. I'm just offering that to you from my experience when I haven't made that selection, and when I knew I wanted to watch someone live because they told me they were going to be live, and I'm holding my phone and nothing's happening. I learned it's because that check mark that said only suggested videos, it wasn't enough. I had to go into my notification settings and choose to be notified of all posts, all video posts. And thanks, Paul. I know I haven't seen you in person in so long. Dr. Paul Tan is awesome. He's in San Francisco, and I used once, maybe 2 times, I temped in his dental office when I was first starting out. So that was 20 years ago or so, and I was so impressed by Dr. Tan. He was just so kind, and I loved working in his office, and his patients were really, really happy. And I'll bet that he's doing some of these things that I've shared with you today. You just know when people are so glad to be there in the office. And for me, it was a real pleasure to work there. And so I remember that. And so we're Facebook friends too. And, you know, having lasting relationships with people is part of what makes us happy in our human lives, right? Why not in our professional lives too? So once again, if you text me at 44222, again, that's 44222, enter in Dr. Darya, DRDARYA, and you'll be prompted to enter your email address so you can receive a download of this same checklist that I just showed you here now. You'll be able to share it with your other dental team members, dentist friends, pass the word along, let them know that I'm here live. I'm thinking I'm going to be doing this about once a week. I'm looking to build a following of other dental professionals so that together we can really help make a positive impact on our dental community, in patients' lives who are maybe avoiding going to the dentist because they're too afraid. And we can do things to help those people improve their health, their own health, their family's health. They can have peace of mind by going to the dentist. And so I would love for you to get on board with me, and let's share great ideas with one another so that we can deliver excellent, high-quality dental care to people and help them feel great about going to the dental office. So again, text 44222, DRDARYA, and you'll be able to be prompted to enter your email address, and you'll be able to receive more notifications from me too via email. So you'll know when I'm going to go on another live broadcast, or if I have more information, I'll just email it to you, okay? So thanks so much for joining me. Enjoy the rest of your weekend, and I look forward to seeing you another time soon. Thanks, everyone. Bye.